Hi there, welcome back. And today we're going to talk about knee problems and as to whether they can cause back problems. We had a question from one of our viewers who asked, if you have knee pain, can that cause your back to hurt as well? The answer is absolutely. I'm Dr. Dan Bockmann, by the way. I have a rehab clinic here in Austin, Texas, and I like to answer these questions for you guys. So first of all, knee and back are really closely related. If you think about it, your legs are the platform that supports your back. So if, for example, if you have enough pain to force you to limp in your knee, in other words, enough knee pain that forces you to walk off or you guard the way you use your knee or you're a little gimpy, then that's going to change what's happening in your hip and low back as well. And just the fact that your knee pain is forcing you to move abnormally can give you some back pain as well. The other connection there too, and again, there are many possible causes for knee pain and back pain. They could be related, they could be completely different, but many times with patients I see here in the office, because all these muscles in your thigh all attach both to your knee and to your hip and back as well, if some of those muscles are too tight, in other words, they're preventing your knee from moving the way it prefers to, forcing it to twist or preventing it from straightening or preventing it from bending, that means the same muscles that are preventing your knee from moving well are also forcing your hip to move abnormally. Hips and low back, think of them kind of as the same thing. Hip is where the thigh attaches to the body, right? It's the platform on which your back sits. If it can't move the way it prefers to, or if it's being forced to move abnormally by tight muscles, that can give you hip pain, back pain, or knee pain, or a combination of all those. In fact, tight muscles or restricted mobility in hips and thighs are the #1 cause for hip pain, #1 cause for low back pain, and also a huge contributor to knee pain as well. So if I have a patient, let's say, who's got knee pain and hip pain, I'm going to check flexibility. I'm going to see, can they straighten their knee all the way? Do they have normal range of motion in their hip? Can they get to 90 degrees easily with both legs straight? If they can't, then we're going to plug in the fix for those things, and that's going to be a combination of stretching and massage. There are two tools that loosen tight things, two therapies. Stretching and massage, those are the most effective therapies to loosen those things. And if we see mobility problems, we're going to plug in the fixes for those things. We're going to see, does the hip pain start trending down over time? Does the back pain start trending down over time? If so, great, that's the likely cause of it. Now, the other side of that possible link between knee and back pain is muscular support. So if the muscles whose job it is to protect your knee, like say quads or hamstrings or hip muscles who are knee protectors, if they're too weak to protect it, that can allow the knee pain to happen in the first place, and is also going to translate to less protection for hip and low back, which can then allow you to hurt those areas as well. So again, we're talking kind of in broad generalities here, but as far as the most likely reasons to explain these things when I see them in my office, these are the go-to things I look for, and fixing those things pays off typically very quickly. And as always, with any injury, there are many possible causes. We're talking about the big, most common ones. But if you feel like there's something seriously wrong with your knee or back or any of you, definitely go see a doctor. It's worth finding out and knowing for sure rather than letting something worsen over time. Hope this has cleared some things up for you. If you have questions, I want to answer them. Leave them down in the comment section below. And if you want more answers to kind of questions and other material like this about how to fix yourself and how to live better, feel better, subscribe and click the bell there, and we'll see you guys next time. Thanks for coming by.